Well, let's speak now to Mohammed Munir, who is a virologist at Lancaster University. Hello to you. Thanks very much indeed for being on the programme. So, first of all, let me ask you about this vaccine trial in the US we've just been talking about. Moderna Inc. is entering late-stage trials backed by the government. How positive are you about the likelihood of success of this and the other vaccine trials?
Well, if we really look on to their phase 1 and phase 2 trial data, which they have published recently, 2 weeks before, based on that, it induces strong antibody responses and T-cell responses with very little side effects and the toxicity into the human application. So based on that data, I'm pretty positive that it would be inducing a strong immune responses. However, there are certain fundamental questions that need to be addressed. Is that phase 1 and phase 2 trial are usually in healthy animal, and phase 3 trial are basically spanning across multiple ethnicities and comorbidities and elderly people with pregnant women and children. So unless we don't really have the data from the phase 3 trial, it is really hard to say anything whether this would be something that we should count on or not.
And globally, numbers are still rising, of course, with more than 60 million confirmed cases now. Are we going to get a handle on this virus, do you think?
Well, Robin, this is a really important question. I think one of the things that I would like to highlight here is that while we have had a little control on this virus in multiple places around the world, that was because of the social distances and the strict control measures we have had. And now, if we look onto the global prevalence of this infection, we still have 80 to 90% people who are not having any antibodies against this virus. So therefore, they don't have any resistance. So any change in the social behavior would certainly bring in this infection to the same level as we have had before in March and April. So certainly there are multiple steps that need to be done at the individual level, at the governmental and national and international level before we can really say that we have a handle on this virus.
Do you think if we are heading towards a second spike, as some people suggest, there are lessons that can be learned from how we dealt with it initially in the initial outbreak?
Yeah, certainly. I mean, down the line, by now 7 months we are into this pandemic. Certain lessons have already been learned. I think we have a very high level of awareness now. People do understand the importance of face covering. They do understand the importance of social distancing and all the personal hygiene that we have been recommending from the beginning. But also at the healthcare sector, we have learned so much about what kind of research is required to really take this one forward and what kind of treatments are working. Remdesivir, dexamethasone, inhalers. We have certain capacity building within the healthcare system as well. So learning from all of these experiences, I'm pretty positive that the second wave, if it would come, it would not be as lethal as we have seen the first one.
OK, good to talk to you. Mohammed Munir, virologist at Lancaster University.